Hey guys, so I'm sorry that I spoke up when Professor Sullivan was speaking about caput and cephalohematoma because I need to correct what I said. So I want you guys to scratch your notes on caput and cephalohematoma and just look at this image. I just got it from online, so you're more than welcome to Google it and I could provide you the link. But with caput sexedemia, which is figure 7.5a, it crosses the suture lines, okay? It's just swelling. You could think of the baby who's had a traumatic vaginal delivery, who's had a vacuum or forceps. It's edema. It's swelling from delivery. And it does cross suture lines, which you can see from this image. I'm going to point to it. Here's your suture line, and it has crossed. Versus B here on the bottom, which is our cephalohematoma, which remember I told you is slightly more concerning because it's blood. This does not cross the suture lines. You'll see the suture line here, and it is not crossing. Really two distinct points. And while the cephalohematoma is slightly more concerning, you can reassure, as long as these have been evaluated, you can reassure the parents that both of these will resolve. Thanks, guys, and I apologize.
Thank you guys for today. I just wanted to take a couple more minutes to finish up the last few slides. We talked a lot about education of the parents and how important that is. You as nurses, information that is important to be provided. Specific to stuff that we talked about today is the importance of baby sleeping on their back to prevent SIDS, the waking of the baby in order to feed them, generally speaking, every 3 hours, and the importance of keeping the cord dry. One thing I didn't talk about is when we do education for diaper change, it's nice to fold the diaper down below the cord so that when the baby does start to void, the cord doesn't get wet from urine. Never take it for granted how important it is for you guys to model behavior for the parents. Even if it's a parent who's had a child before, you can show them how to change the diaper and then ask them to repeat it back for you. You can do a demo of a sponge bath, and then the next day they could perhaps do it back, and always ask them if they have questions. And just remember that everything that you're teaching them is new to them, even if they've had other babies. And again, if this is not their first babies, it's important to encourage the role of siblings and how important they are in helping the parents to take care of the baby so that they don't feel left out. One thing that's come up in clinical practice is how important it is for a parent to bond with newborns during feeding time, especially with younger moms, not to be on the phone or playing with their cell phone during this special time, because that's when mom gets to really know the baby. And again, talking to the baby, even reading books to the baby, they do well just from hearing mom's voice. The next slide talks about newborn identification. We talked about in labor and delivery, mom gets a band, baby gets a band, and mom's partner gets a band. These bands are going to be worn throughout the hospital stay, always to be checked. Even if you're the person who has to take the baby to see the pediatrician and bring the baby back, don't ever assume. Always double check, recheck bands. Another thing that comes up is if mom is going to take a shower, there's nobody in the room. Mom can ask to have the baby brought back to the nursery for a little while, so baby's not left alone in the room. In addition to the ID bands, all infants get a hugs tag, which you see in the picture. This is, God forbid, the baby was removed from the unit. The hospital goes into shutdown, so the baby cannot be allowed to leave the unit. Another take-home for the hepatitis B vaccine. Standard, all babies get the hepatitis B. Again, we discussed the importance of getting mom's consent prior. If mom is Hep B positive, the baby gets 2 shots. The second shot will be the, we call it the HBIG. It's the hepatitis B immune globulin shot, in addition to the Hep B. That's for moms who are positive. And the second and third doses of your hepatitis are going to be given at the pediatrician's office. We talked a lot about infection, the importance of washing hands, keeping your stethoscopes clean, instructing friends. We didn't get a chance to talk about if mom has a fever. It's okay for mom and baby to be together. Baby may or may not need monitoring by the NICU depending on the cause of mom's fever, but mom can nurse and mom is certainly allowed to bond with baby. I mentioned a slide on newborn screening tests. These are 3 tests that are required prior to discharge of baby. It's the nurse's responsibility to make sure these are done. The hearing screen, we talked a little bit about the heart defect. It's called CCHG. It's done with a pulse ox on a hand and a foot. The measurements are looked at for a differential. This is just an early screening. What they found was happening was there were undiagnosed heart defects, and this is helpful to pick them up before discharge. The last one is a heel stick. If you look at the picture in the slide, it shows you where to stick the baby's heel. One of the key points of doing a heel stick, we talked a lot about thermoregulation, is that the baby's foot is warm. The baby's foot has poor perfusion and is cold. Your heel stick's not going to work that well. Hard to see on the picture, but you will see there's a lot of blood that is required for this, and if it's a cold, the baby's going to clot much quicker. Again, the heel stick has to be done after 24 hours, but before going home. Stuff just to be aware of. Going back to the hearing screening, it's done on all babies. They very rare in well babies, 1 in 1,000 versus 2 to 4% of NICU babies. But if you find it early, it'll increase our chances of doing better later on. And again, your job, if baby doesn't pass, is to provide reassurance to the parents that they will have an outside referral to see what's going on. Finally, the last slide is everything we discussed is the importance of swaddling, how to use a bulb syringe, checking for wet diapers, change the diaper with every feed, sponge baths so that the cord does not get wet, importance of feeding every 2 to 3 hours even if baby's sleeping, soothing the baby, sleeping on their back. They get a little bit older, it's important for babies to have tummy time to develop their neck muscles. We talked to back to sleep. All of these things, including what to do if baby has a temp. I always reassure the parents they can call the nursery and ask, or never hesitate to call the pediatrician. And the final thing that to remind everybody, when a baby goes home, they have to have a car seat. So just make sure you remind mom and dad to bring the car seat in on the day of discharge so baby can go home safely. Thank you. Let us know if you have any questions.